work, so fresh out the press.
Good morning. I'm Ray Lander, MD, FACP, and MACGS. What does those letters mean? It means that besides being a medical doctor, I'm a well-trained specialist and an internist and belong to the group called ACP, or American College of Physicians, which is a group of the certified specialists in internal medicine. And MACGS is a master in American College of Geriatric Specialists, which actually deals more of the elderly patient. I think everything that Dr. You actually in here decides that the best that we could do is do the two best procedures that we are offering you. And that is actually the laser medicine and the stem cell therapy, because the medical management is not without complication. As you have seen, the NSAID, or the non-steroidal anti-inflammatory drugs, would cause a lot of inflammatory reactions in the stomach lining, causing ulcer, and worse, especially in the elderly, in my practice, have shown a lot of upper GI bleeding. And of course, in the early 2017, the LA Times have published the series of every Sunday newspaper that there have been a lot of overdosage and death from the use of narcotics. So with that, you're only going to go to surgery, which is not without complication too. You have lots of infection, the long duration of healing, so on and so forth. So I think we're offering you these two kinds of things that actually without non-addicting and non-invasive procedure, and actually very promising. The stem cell management is still in its infancy, but it actually holds a lot of promise. And I'll tell you how Dr. Yu and I had worked together is that I was his patient before. Because of the age, the osteoarthritic changes in my neck, especially, had actually caused degenerative joint disease, wherein my C4, C5, C6, and C7 have gone down a lot and have caused a lot of pain, especially catching the bulging of the nerves in there. So at first, I have consulted rheumatologists, orthopedic surgeons, and pain management specialists. All of them have suggested, well, I'm at this stage that I have to have surgery. But I'm conservative. I don't want that. I don't want being, my spine will be actually screwed with each other like that. And I could, I hate it, and I don't want surgery. So I was into being managed with medication, medical wise, and as I told you, it's not without complication. And every so often, the most that I take is Tylenol. I hate NSAID, and most especially the narcotics. And those are the things that I want to actually avoid. And of course, surgery is not, not for me to. I don't like that. So when I heard about Dr. Philip Yu, in fact, during the early stages of his career, if you would find me trying to actually tell everyone that it's a good procedure that I've had, because I was suffering from 8 to 9 pain. After 3-4 months of my laser management, it went down to 1 and 2. Tremendous, reduction of the pain that I have. And then after that, we just bumped into each other in Las Vegas at the Stem Cell Institute of America conference. And we decided, that we put this up because it could help a lot of the elderly patients suffering from joint problems. So I think that's all we could really advise. And I was chosen as the medical director by Dr. Philippe, having experience of 51 years, UC trained, UCI and UCLA. Thank you very much.
All right. And then we actually have another doctor who just went through the procedure. Dr. Ron, if you don't mind coming up today. All right. And by the way, you don't have to be a doctor to get treatment from us. We'll take more patients too. There you go.
Hi, my name is Dr. Ron Yamachika. I'm a EDS and MSDB also too. Practice oral surgery for 40 years in Orange County plus 4 years active duty with the Navy. I've been kind of researching this for quite a while, and well, 6 months ago I went to see my orthopedic surgeon because I was having problems with my knees, and it was just a matter of time because when I was playing golf, I really bent up to pick up the ball, and that was kind of demeaning to me. It was, you can just go down to Roger and get one of those, put on your head of your glove and just each time pick up the ball. And that wasn't for me. So finally I decided to come to a lecture. In fact, I was sitting right there, August 1st, Friday. And a week later, I called his office, I set up a consultation appointment, and I listened to what he said, and he had a lot of merit in exactly what he was saying, because I believe in his treatments. So we decided to get the laser treatment first. So I went through 6 treatments. After the 5th treatment, which was last Friday, I really didn't feel anything, but Saturday morning when I woke up, I noticed my knees did not have that heavy feeling. And it was, I really didn't have that much pain, maybe 1 or 2 as far as in a range from 1 to 10. So decided, hey, looks like this thing is, procedure is working. So I finally came in on Monday for my last treatment. And then I had to come back on Tuesday for a follow-up and a consultation with the doctor. So then at that time, we were talking, and previous to that, I highly recommend that you go to hear a lecture on the stem cells. I'm really interested in the stem cell because in my profession, the stem cells were used when you do an implant, so the bone regenerates quicker. I had an implant done, but I had to wait 3 months, so my classmates said, Ron, let's wait another 3 months just to be sure that the bone is completely set as far as the implant. So, okay, fine. That's an inconvenience for 6 months without the final restoration or the tooth. So anyway, I went through that, and then now they're also using stem cells in bone grafts. As far as the gum specialists are concerned, they use that a lot now. So anyway, I finally decided, let's get the stem cell treatment done. So I had it done on Wednesday. Very painless procedure. When I mean painless, real painless and non-invasive. And here I am today, and I'm feeling great. I mean, the heaviness in my knees went away, and I just feel great. And like I said, Dr. Yu's office, they take care of you from the start all the way to the end. Just because he injected the stem cell, it wasn't sayonara, aloha, goodbye. He's following me up for a whole year. And, as the saying goes, a lot of times when you go in for consultation, God, I really like the doctor, but God, I couldn't stand the staff. They were rude and whatever. Well, vice versa, you can say, God, I didn't like the doctor, but God, the staff was great. Well, if you come to see Dr. Yu, you don't worry about that. Everybody is professional, compassionate, and caring for you, and they want to succeed. So like I said, I'm very happy with the treatment, and I want to start playing golf again when we have to hold out for 3 weeks and then maybe take it from there. And I'm kind of really believe in the stem cells because if you saw on the screen, famous athletes like Jack Nicklaus, Peyton Manning, but most importantly, like Tiger Woods. He's still playing right now. He's playing some of the best golf. And just recently, the pitcher for the Angels, the Japanese phenom, Shohei Ohtani, had the PRP, or platelet-rich plasma with stem cells injected into his right elbow. Well, after 3 weeks, he was batting. And now, on Sunday, he's going to pitch his first game. And just recently, another golfer, Ricky Fowler, he kind of tore his oblique muscle, or had a partial tear. But he wants to play in the Ryder Cup the end of September. So he also had the PRP with the stem cell injected in. Looks like he's going to play. So like I said, if you're really interested in healing, and I'm interested definitely in healing. I don't want any more surgeries on me because I have both my hips replaced. I had an excellent orthopedic surgeon. I had no pain with this guy. Then my knees started to go bad. I wasn't going to get knee joint replacement, so that's why I came and consulted Dr. Yu. So here I am today, 3 days after the procedure, I'm feeling fine. I can stand up. I don't feel that wobbly feeling that I had when I stood up. So anyway, that's my story. So thank you.
All right. Give the Admiral a hand for that. So, we're about to wrap up here before we serve you the lunch. So the